our cases are dropping dramatically now. And that's because of your decisions, like vaccination, like staying the course on the public health measures. The last 15 months have been incredibly challenging. That's true almost everywhere in the world. But I believe we should give thanks for the sacrifices that many Ontarians have made. And because of them, we've turned the corner in our progress against the pandemic. The modeling we will share today suggests that, with a few points of caution, we can look forward to a much better summer.
Encouraging news today from the province's latest COVID modeling projections. Cases are dropping, but we're being warned we're not out of the woods yet. The Delta variant is a potential stumbling block in this province's recovery.
There was also an emphasis on speeding up second doses of vaccines on the same day the province announced the second shot hotspot strategy. So joining us on CP24 tonight to discuss the issues are infectious diseases specialist Dr. Chagla, the director of critical care at Michael Garron Hospital, Dr. Michael Warner, and epidemiologist Deonandan. Thank you all for being here. Dr. Chagla, I want to start with you as the infectious diseases expert on the panel here. What do you make of this second shot strategy? Is it enough of a strategy to push enough shots into the hotspot regions the province was talking about today?
Yeah, I think it's a reasonable strategy. I think we're learning from what happened in the UK. They saw big rises in Bolton, in other regions in the peripheries of the UK. It was concerning. There were hospitalizations, but as they started pushing vaccines into that population, getting people fully immunized, things stabilized within 2 to 3 weeks. So, we're looking at the UK, trying to learn our lessons from them. We knew transmission was hot in some of these hotspots. The Delta variant is now here. It just makes sense that we just keep pushing vaccines there. The only thing I would say that is missing from today's strategy is something rational for the folks that took AstraZeneca. And I think, that unfortunately, the hotspot pushing of vaccines covers the people that took Pfizer or Moderna, but doesn't cover the people that took AstraZeneca that still have a few more weeks to wait. And really, if we want to get them fully immunized, we likely need to drop down the limits to 8 weeks and give them AstraZeneca or an mRNA vaccine as part of this strategy.
And when we think about the Delta variant and the importance of vaccinating those people who got AZ as their first dose because of the Delta variant, how significant would that strain be in impacting this reopening as we see patios setting up for tomorrow?
It's the big confounder in all of this. It's the one thing we're really quite concerned about, which is why accelerating that second dose is so important. 2 doses of Pfizer and Moderna give us about 88%, maybe close to 90% protection. 1 dose, maybe about 30%. With AstraZeneca, it's more like 60% with 2 doses. And so forth. So it's important to get a second dose into people, and it's important, as Dr. Chagla points out, to have something done for the AstraZeneca people. Accelerate a second dose for them and give them, and encourage them, I think, to take the option of an mRNA vaccine. That's how we get Delta under control.
The province did seem to suggest, that maybe they're analyzing the data and maybe something will change with AstraZeneca, but as it stands, of course, right now, we do know it's 12 weeks. Dr. Warner, I want to turn to you because, you've been a big advocate for essential workers in this pandemic and ensuring they got their first shots as quickly as possible, which, of course, you were taking issue with. Do you see today's strategy as helping them get their second shots fast enough?
Well, I'm not really clear because what Minister Elliott said is that eligibility criteria in those 7 public health units where the Delta is active will have expanded eligibility criteria starting on Monday. What was more cryptic in the announcement is whether supply will be increased commensurate with demand. And I hope that it will be. And what she said is that when the freezers are empty, the province will fill them up. It's just not clear whether they'll be filled up with more than they had in the first place. And there may be public health units who have a difficult time getting vaccines out the door. And if they're having a difficult time getting them in arms, then I think it's incumbent on the province to make sure, especially in those public health units that are hardest hit, that they get the help they need. Getting the first shot in the first 50 or 60% of people is relatively easy. Getting the first shot into the last 20% is hard because it's a different strategy. And maybe they need new resources to get those first shots in and also to ramp up the operational efficiency to get their second shots into eligible residents.
So, Raywatt, from an epidemiological point of view here, when they're talking about, effectively letting freezers run very low and then restocking, is that an effective way of tackling and trying to stay ahead of Delta?
We don't want the freezers to be filled with doses not being used. We got to accelerate those second doses. So to my mind, there are 4 things that have to happen. We have to accelerate those second doses. We have to shorten the interval between the first and second doses as much as we can. We have to prioritize hotspots and essential workers, as I think we're doing. And we have to avoid the temptation to open things up too early. Now, so far, it looks like we're doing all of those things to some extent, except for shortening the interval sufficiently. So I'm filled with confidence, but let's hope it's not misplaced confidence.
Brampton's Mayor Patrick Brown issued a statement thanking the Ontario government for targeting these hotspots with the Delta variant, saying the average age of an essential worker is 36. And so many of them will be able to get that vaccination sooner. But Dr. Chagla, what is the concern in reaching those people? We know some essential workers at long-term care homes are not vaccinated. It's still leading to some of them being locked down, and vaccinated residents can't get outside. So how do we target the people who haven't been vaccinated yet?
Yeah, I mean, I think this is where local public health units and resources to empower them are important, using local cultural leaders, using local supports, using local networks for hard to reach and vulnerable populations. Putting the vaccines into their hands and being points of trust are important. We know there are people in transient populations, in very racialized populations that still have questions about these vaccines, that are still wanting to get answers about these vaccines that haven't got there. And as much as we do think about that second dose strategy, which is incredibly important, there are first doses that are still missing in people. And, dollars to donuts, that first dose is still probably the most important thing to keep those people out of hospital. Even in the UK, going through the Delta experience, the people that are overrepresented are the unvaccinated. In Washington, D.C., the people that are in hospital are overrepresented by unvaccinated. In Seattle, the people that are, again, overrepresented are the unvaccinated. And so, I think as we're trying to deal with the healthcare surge, you have to resource those places to get first doses into people and use local capacity to do it.
Dr. Werner, can we talk about ICUs for a second? Because, of course, it came up in the modeling today how the ICU data and those numbers are sort of a lagging indicator because, people get sicker, then they get into the ICUs, then they sort of slowly start to recover. What are you seeing in the ICUs right now, and how has that changed, say, in the last 4 or 5 weeks?
I'm seeing many more patients without COVID. Almost no new patients with COVID. I think there were only 17 yesterday across the province. What remains to be seen is whether we're going to see people presenting with later presentation disease because things have been festering while the healthcare system has been relatively shut down to non-COVID related care. I think that'll be the next story we're talking about in ICUs. But we're in a transition period where there's almost no new COVID activity. The patients we have are now chronically critically ill, which is unfortunate. It's unclear how long it will take them to get better because many of them are young, but there's much more capacity in the hospitals. Nurses are going back to their usual care areas and operating rooms are opening up. So it's a good news story in the hospital.
I remember, Dr. Warner, you saying that at the peak of this, the patients in your ICU didn't look like you. They were essential workers. They didn't get vaccinated yet. How much of that is still playing a role in the ICU?
And the patients we have in the ICU acquire their infection in March and April. They've been there for 30, 40, 50, sometimes 60 days now. So that hasn't changed. They still don't look like me. And there are so few new patients that it's hard for me to see a pattern. But let's hope that we get our essential workers and racialized populations their second shot, as everybody should eventually, so that we don't see a recurrence of what we saw in waves 1, 2, and 3.
Raywat, in today's modeling, they had a green line, a yellow line, and I believe it was a blue line showing where things could go based on vaccinations. I'm not sure if this was factored in, but we also found out today that another 7 million doses of Moderna are going to be arriving in Canada by the end of this month. How significant do you see those 7 million doses being as we are, again, trying to get ahead of Delta?
It's huge. As Dr. Warner was saying, it comes down to will the freezers be filled with vaccines or not. So this will hopefully fill those freezers. Now, how much is Ontario getting? I'm assuming the lion's share due to per capita distribution. And it also opens the door to mixing and matching a bit more. So I think we're going to be a bit more comfortable with using Moderna as second shots for AstraZeneca people pretty soon. So I'll wait for that guidance from NACI to come down.
Okay, it's been great to chat with all of you again. Dr. Chagla, Dr. Warner, Deonandan, thank you so much for joining us once again.
Thank you.
No problem.